I began with creating my base from speed videos, Dr. Farooq's videos, and I read all of those. The textual part of the speed app was absolutely amazing. The videos, they were beautifully made because they started with the basics. They started with what we knew at the end of our MS, and then they took us to the Campbell level. So, which is why I found those videos to be very beautifully crafted. Actually, enrolled into Speed App, I think 2 or 3 times previously as well during my MS preparation.
So I bring in all the wishes and greetings on behalf of all the faculty members of Speed Medical Institute to
Thank
Dr.
you, sir.
Mehul Gupta for scoring a topmost rank. Not topmost rank means rank number one in AML in NEES April session 2024 in specialty of MCH Urology. And AML rank 1 is something great achievement, and I congratulate you for what you have done.
Thank you, sir.
So great. Can we know about your detailed brief history from where you started till date, what all you have done?
Sir, I started my MBBS from AIIMS Delhi itself. I started off in 2015, and after 5.5 years of MBBS, after 2015, I immediately went on to continue in AIIMS Delhi as an MS surgery candidate. So that started from 2021 and lasted till 2023. And in 2023, when I left my MS general surgery after completing it, I was actually on the course of proceeding towards the ECFMG certification and USMLE exams.
Yeah.
So I was actually on the course of completing my ECFMG certification and the USMLE exams, but then eventually I decided to stay back in India, and somewhere around March I began my preparation for the exam.
So there is something called born and brought up and lived. There is always a saying, and there is no doubt this is heading towards urology in New Delhi. Huh? So
I'll be lucky that way, sir.
yeah, it is always that way, na. So you want it that way, it is happening that way. That's the beauty of it. Huh?
Thank you, sir.
So great to be in the country's premier institute and to
Thank
do
you, sir.
MBBS to MS to super specialty all in one
Uh,
go. And
it does feel extremely amazing, sir.
and the history is also very clear. Everything you say now from UG, PG, super specialty, only one institute. It is same.
Yeah. I wasn't really thinking about going to other places, so I was like, let's stay here.
So it's very nice, very beautifully crafted, crafted,
Thank you, sir.
engineered, and executed. That's the execution, the plan. Na? Very great.
Thanks.
Okay, now let us come to the point of
Yes, sir.
your preparation. And I mean, how long you preparing, what you're preparing, and how did you do it, and how did you execute this, and you get the topmost rank one.
So, my preparation started in March, somewhere around March 10, March 15. I naturally had a very short period of time to prepare. So, I did a very focused preparation. I began with creating my base from speed videos, Dr. Farooq's videos, and I read all of those. That took me about 20-25 days because it was important to go through all of those videos. And plus, AIMS has a tendency to ask about recent guidelines, especially given the fact that in 2021, 2023, 2024, I think in 2022 also, probably, I'm not aware, there have been a lot of updates, both in AUA and in EAU. In fact, we had one of these questions directly picked up out of a guideline in which they had asked us about metastatic RCC. They had given us a risk stratification and asked us about the appropriate therapy. And they had options out of the older guidelines as well as the newer guidelines. So, for the first 20-25 days, I focused on creating my notes, reading whatever study material I had from Dr. Farooq's videos, and just grasping the content. In my first go, I typically never try to memorize the entire thing because I feel like, given the fact that I'm memorizing so much in such a short period of time, it's only natural that I'll forget things eventually. And the last thing I want to do is read something and forget it just before the exam. So my main aim is of the first 25 or 30 days of reading is to focus on creating the best possible version of my notes that I can. So that's like a one stop prior to the exam that I need to pick up, and I do not need to go anywhere apart from those notes. So that is what I focused on till roughly April 5, April 10. Following April 5, April 10, over the next, I would say, 2 weeks, I just kept revising those notes over and over again. So I tried to do my notes properly and give as many grand tests and concentrate more on the basis and more on the basics and more on the oncology aspects.
There were grand tests in the app itself. So did you try those?
Sir, I did, however, I mean, the reason I love the speed app was honestly not its questions. The reason why I'm being honest is because I understand that this is a way of improvement for everyone. So the textual part of the speed app was absolutely amazing. The videos, Dr. Farouk's videos were amazing and they were concise.
Now, the preparation of your March start to this April, probably approximately a month's time, I believe, right?
Sir, 1.5 months, 1.5 months roughly.
That's almost 45 days.
Yeah,
So,
45 days.
so in the 45 days, because urology is not an exposed aspect in general surgery. I mean, it's not like a gastro that has been fully kind of exposed to a surgical resident. So, I mean, if you could, I mean, how you were able to cover within a short span of time?
Sir, I won't say that urology is not. I mean, sure, the everyone has the urology posting, which is only of 1 month, and in that posting, you're basically working as a JR. So it's not like you're exposed to the cases practical aspect of it all. But when it comes to the theory, urology actually makes up for a very important component of the MS final exam. So I won't say that my preparation actually started from May, and I would say that the fact that I gave my MS exam recently and that I had focused on urology and general surgery during my MS exam, that probably played an important component. So the exposure in terms of urology for MS surgery is majorly through the theory exam. But when people actually prepare for their MS exam, they should be thorough with the subject that they might be pursuing in their super specialty.
Yeah, because the kind of what I was trying to ask you is the kind of exposure for urology in the super specialty standards of a
Yes.
Campbell standard. That exposure may not be that much. I mean, of course, general
No,
surgery
that
standard
is what is definitely very less. Yes, sir.
very less. But when you compare the gastrosurgery or rest of oncology, there could be
That's
some
true.
overlap of
Definitely.
20 to 30%. From
Sir, yeah, I think that is where Farouk sir came in. Like he very beautifully bridged the gap. So yeah, Farouk sir's videos they were beautifully made because they started with the basics. They started with what we knew at the end of our MS, and then they took us to the Campbell level. So which is why I found those videos to be very beautifully crafted.
Yeah, because you need to give the depth of 12th edition of Campbell in a way
Definitely,
students should understand. So that's very
definitely,
important to crack this
def-
exam.
definitely, sir. Definitely. I mean, just the MS exam level of knowledge could not have helped me crack the exam. I mean, there were almost all questions required some level of knowledge of Campbell.
Hmm.
The only difference is not about the numbers and the facts, but the concepts and the risk stratifications and the management options.
Yes.
But definitely, Campbell, this is not something that could have been tracked just by Sabiston or Bailey's alone.
Yeah. So
Definitely, sir.
now when you look at the question paper, I mean, it was what is a 60-20 or how it was?
Sir, it's difficult to count. I mean, it's 80 questions in continuation.
So you not
I
know
mean,
how much is from urology and how much is from
I
the.
would say majority, sir. Majority were urology, roughly about 50, and around 30 would have been in general surgery.
So the
But again, I might be grossly off the right numbers here because it does. You don't really look at the number of questions while you're answering. You're just going in a flow.
no, I was to ask that your primary preparation would have been a super specialty, though that this general surgery numbers would have not been able to kind of grasp because that's what my
Yes.
question was.
So General surgery actually was not very difficult. There were a lot of repeat questions, which is again something that I would want to advise everyone that please go through repeat question papers. If you can find them on the apps, that's a great thing. If you cannot find them on the apps, go talk to your seniors about what questions they had when they gave the exam, at least for the past 2 to 3 years. Um, there were a lot of repeat questions. In fact, in one of the questions, there was this question on Shah's penile processes, which was a theoretical question in one of the previous exams, and then it came as a pictorial question in our exam. So they would quiz the questions so and so, but they would give a repeat question in many cases. Even for general surgery, a lot of the topics were repeated. Breast and endocrine was a scary part of general surgery that they had gone into significant depths of, and I was very confused about those questions in breast and endocrine. Outside of breast and endocrine, I would say more or less the general surgery was pretty doable, sir.
Now, how many questions can we know that you have attended this exam of 80?
So I was, I mean, again, when I say that I had attempted, I mean the questions that I was comfortable with. Some of them might have been wrong, obviously.
So total number only. It is not that how many right and wrong. It's only out of 80, is attempted 80 out of 80 or
Sir,
something.
my final count was 79.
One question is the.
I mean, I was about to leave it at 74, then I did a mathematical analysis in my head that the maximum I lose if I guess all the 5 questions, which I had absolutely no idea of, I would lose 1 to 2 marks. So that was the risk I was willing to take. So I
So
was like,
you feel that 5 question is the game changer for rank one?
absolutely not, sir. I lost 0.3 marks.
Uh,
That
okay.
bit me back. So,
So now, how did you work on this interview part?
for the interview now, there are a few things. First of all, there will be about 3 to 4 questions. The questions would more or less be in an OSCE format. So asking my seniors and watching a few videos on YouTube, I noticed that people were typically reading sabness for instruments, and uh, for the radiology aspect, they were either going on basis of their own experience or they were reading a bit from Sabness itself or from the Radiopedia sort of websites, which were fairly helpful. And then, as for the gross pathology aspect, again, people could prefer a practical urology manual or they could uh, answer them from their own experience. The instrument part was the tough part. As for the imaging, they'll typically give tumor, ask about the stage, and then ask about the management subsequently. But the questions actually make up only a small aspect of the interview. It is, I mean, I think they make up a very small aspect. It's more about the faculties want to ask you about your entire CV. They will ask you about what you've done starting from your MBBS, the amount of academic publications you've had, your thesis, MS thesis. They'll ask you about the papers you've come up with, the presentations, the conferences, the medals that you've won over the years, which sort of makes sense because AIMS is primarily an academic institute. So the interview was a lot focused on the academic progress, and then they asked me about 3 or 4 questions.
Okay. Now, what will be your advice for the aspirants of MCH Urology in future?
So my advice would be to first of all to trust the notes more than to trust the grantees and trust the test series, because the grantees, the test series, and the question banks everywhere are still developing. They're still in their development phase. Trust the notes and be strong on the conceptual aspect. Be so strong that if someone wants you to explain the entire topic to them, you can sit down with a piece of paper and explain the entire topic to them. Apart from that, I would say that particularly for my examination, and I think this was suggested by Dr. Cyril as well in the last interview, uh, last semester's interview, that AIMS has a tendency to ask breast and endocrine in general surgery. I do not have time to read it, but if the aspirant has time to read it, I would advise them to go through breast and endocrine in a short period of time. Go through it prior to starting your urology preparation. Go through it, create your notes and prepare your books, and then just close it. and then open it up in the last 1 or 2 weeks of your preparation, when you just have to go through it in a very fast way and learn the concepts. Otherwise, focus predominantly on urology, and you must do the previous year papers, not just the question, but you should go into the concept of what they've asked.
Great. Now, can I know from you how,
Yes, sir.
how did you choose Speed app?
So, sir, Speed App, it was suggested. I've actually enrolled into Speed App, I think 2 or 3 times previously as well, during my MS preparation for
Oh,
like 6 months
you
period or so.
you are already taken Speed.
Yeah, I did, and my brother is actually an MCH urologist. I mean, he's a second year urology resident, who had also done his preparation partly from Speed App. So,
What is his name?
sir, he is Ekansh Gupta. So he's
Oh,
actually
okay.
one of my
History is very strong. Okay, so he suggested you. Or,
Yeah. So I sort of drew half much of my inspiration from him.
okay.
And yeah.
So it is a real honor for Speed that you
No,
are.
sir. I mean, the honor is all mine. I was lucky enough to come across such amazing teachers, sir.
So it's wonderful.
Thank
Now,
you so much.
so now we're heading towards this admission now. I think when is the date of joining of MCH Urology?
It's in June, somewhere around June mid. I have to submit the documents. I think around June 20 to 26, and then the session per se starts from July 1st. So.
The hostel still is there or vacated?
So I had to vacate the hostel. I mean, I left the campus. They threw me out. So I will go back to the hostels though. I can't
Is the
stop
room
missing those
different or
hostels.
room is also the same or it is different?
So the rooms get upgraded. Like in undergraduate, although they're practically the same. In undergraduate, the room is a single room.
Ah,
In post graduation, it's practically a double room given to one resident. So it's a much bigger room.
upgradation happens.
Upgradation, sir. It's
So,
pretty exciting.
exciting, huh? So
Definitely.
almost 12 years.
12 years, sir.
The
12 years
entire
I've been.
prime lifetime.
Yes, sir.
That's great. So now it is time to thank and whom all you want to wish that they have built your career and been a part of your building up of your career so far.
Definitely, sir. I mean, of course, first of all, the biggest thanks goes to Farouk sir for his videos and his speed app. Then, apart from that, I've been lucky enough to have very strong support systems, and I think that forms a major part of everyone's preparation, planning, and success. I've had my brother, as I said, he's an MCH resident, second year. I've had my parents. My dad's a urologist. My mom's a gynecologist. So I've come from a family of doctors, and during, especially when you're preparing within 1.5 to 2 months, there'll be a lot of days when you'll be absolutely unsure of your future. You'll be scared, and there'll be days when you'll just want to give up. In fact, this is where the third and probably the most important advice would come in, is that just push through. Like, you you do not know what your result will be till you give it your absolute best. And your job is not to actually sit and plan the result. Your job is to give your absolute best, so that no matter what the result is, you feel satisfied with yourself. So I had a very strong support system, and they just kept asking me to push through. And yeah, that's it. I think my teachers and my support system, they make up 90% of my preparation, sir. The rest 10% is me.
Great. Is probably the urology is coded, gene coded?
So it's something we've grown up discussing over dinner table. So uh, we sort of started liking it.
Mm. So it'd be a happy father, right?
Yeah. My dad is absolutely ecstatic.
What kind of a feel he will have as a legacy that both of you could carry on his behalf?
That's the hope, sir. That's the hope.
So
That's the that's the hope.
so what is his name actually?
Sir, he's Dr. Ashok Gupta, sir. He is a practicing neurologist in Delhi, in Maharaja Agassiz Hospital in Punjabi Bagh and Jaipur Hospital in Rohini, sir.
Convey my best wishes, congratulations.
Definitely, sir.
And regards to him for creating such a wonderful sons in his in a super speciality field. And,
Thank you so much,
and
sir.
also
I will.
and to your mother as well. Yes.
Thank you, sir. I will, sir.
From our institute. So once again, we wish you all the very best for your great career in urology. At the most, you are also very open to a lot of things for guiding the students, because students who watch this video definitely will be inspired to know.
Thank you, sir. That's the hope, sir.
Go on. So we wish you a great career in urology and all the best and all the success. Keep in touch with us. And
thank
we
you, sir. Definitely,
like to see you inspiring as always. All the best.
Thank you, sir. Bye, sir.
Bye.